tells Parliament how far it will go to protect Singapore from the coronavirus. Built in 10 days, the Wuhan hospital, built to stay ahead of the coronavirus, opens its doors today. And finally, Professor Paul Tambaya from NUH Infectious Diseases Division is live in studio to answer your burning questions. It's the start of the new week. You're watching The Big Story, where we will discuss the hottest topics of the day and explain why they matter. I'm Haryanto Diman, coming to you live from the Straits Times newsroom. Now, later in our show today, we have NUH Professor Paul Tambaya in studio. He's an expert on infectious diseases, so do send us your questions in the comments section below. But first, National Development Minister Lawrence Wong gave an update on the people under quarantine in Parliament today.
As of last night, there are 524 persons under quarantine. 222 are in government quarantine facilities, and 302 are serving quarantine at home.
Also speaking in Parliament, Health Minister Gan Kim Yong said Singapore has set up multiple lines of defence to reduce the risk of imported cases and local community spread of the coronavirus.
We have been stepping up our posture and efforts at each line of defense. We are not sure how long this virus will turn out. Therefore, we must stand ready to respond to new developments as the situation evolves.
To tell us more, we have news editor Zakir Hussain. Welcome, Zakir. Now, Zakir, Minister Gan Kim Yong outlined a few things in his ministerial statement, now one of which he talked about multiple lines of defense. Could you elaborate on that?
Right. So I think the first line of defense is to prevent the importation of possible cases of the virus. And I think in the past 2 days or so, we've had tighter travel controls to make sure that those, with a higher risk are not allowed entry. The second tier is really preparing our healthcare institutions, in the event of a surge in cases. And I think the National Centre for Infectious Diseases, as well as at the ground, GPs, the medical infrastructure is in place to deal with cases should they come up. But I think the third line of defense is also interesting, and that's sort of at the social and community level. And I think it's important for people to not overreact, but at the same time to also show consideration. If you're not well, please don't go out or mingle in crowded places, for instance.
Now, the Minister also highlighted the different scenarios of how this could play out.
That's right, yeah. I think the first scenario is that the contagion actually spills out beyond Wuhan or actually hits other countries in a larger way. And I think the government's not ruled out the possibility of implementing even tougher travel measures. The second one is sort of the one I think many people fear, that there's community spread locally. Now, for the past week and to date, there's not been an indication of that. But it's tough, and I think it's something you have to be prepared for. And I think, if in the event that there's community spread, schools might need to be closed, for instance. Hospitals might need to, divert or turn away non-essential care services. Many mass gatherings, for instance, might have to be cancelled. And I think the third scenario is even more, how would I say, it's more unlikely, but it could still, you can't rule it out. And, if the virus mutates to something more infectious and there's a pandemic, it's something to worry about should that happen.
Now, let's move on to the ministerial statement by Minister Lawrence Wong. He gave an update of those under quarantine. Now, he also reminded people to be wary of inaccurate news going around and to focus on the positives. Yeah.
I think that's a real concern because our colleagues have found that, for instance, there are cases of people who may have returned from mainland China, not Wuhan, but returned from mainland China in the past week or so, and they have to take leave of absence from work, to avoid possible spread should they fall ill. Some of them have unfortunately been turned out by their landlords. And that's actually, I think the minister called it irrational and irresponsible behavior. That's not helpful. But at the same time, you also have cases of heartwarming stories. For instance, students at NUS, who actually help buy food, help deliver care packages for fellow students who have to be well, not so much quarantined, but who have to be quarantined or have to spend leave of absence because they were back in China. So I think these are some of the examples that I think Singaporeans should really try and do more of, rather than react and exacerbate the anxiety there is out there.
Right. So really the focus is to look at the positives, right, of how this crisis has banded the people together.
Yeah, I think
instead of effort to combat the virus.
That's right. Yeah. So I think it's if people need to spend their leave of absence somewhere, you can't expect them to do it out in the streets as well.
Well, thank you so much, Zak, for coming on to the show to tell us more on what has happened in Parliament earlier on. For more on the coronavirus, you can head to straitstimes.com. Moving overseas, there's still no sign of a slowdown to the rapidly spreading coronavirus in China. Latest numbers from China, 57 deaths on Sunday, up from 45 a day earlier. Many governments around the world have praised China for measures it has taken to stay a step ahead. And nothing symbolizes China's effort more than the 2 hospitals it built from scratch in just 10 days. About 1,400 military medics will treat coronavirus patients at the 1,000-bed Shan Hospital, or Fire God Mountain in Chinese, as the hospital starts receiving patients today. Construction of the 25,000 square meter hospital, approximately the size of 20 Olympic-sized swimming pools, began on 24th January. The Shan Hospital is one of 2 makeshift medical facilities that the Chinese authorities decided to build in order to relieve hospitals swamped with patients in Wuhan. The second field hospital, spanning 60,000 square meters, Lessen Shan Hospital, is set to start admitting patients on 5th February with 1,600 beds. To share more on this, we have China Bureau Chief Tan Don Wei live on Skype. Hi, Don.
Hi.
Don, understand that you are still at home, quarantined, yeah?
Yes, that's right.
Just to be on the safe side, of course. Don, if you could tell us, how is the first day of operations for Shan Hospital? Are things going smoothly there?
The People's Liberation Army has taken over the running of the hospital, and 1,400 medics, many of them who have experienced battling SARS and even Ebola in Sierra Leone and Liberia, are now working at this new facility, which has 1,000 beds. It is a specialized hospital used just for treating patients who have this new coronavirus, and it will go some way in easing the acute bed crunch that Wuhan is now facing. A second hospital, Lessen, is scheduled to be completed by Wednesday, and that will have 1,600 beds. So combined, there will be 2,600 beds, in addition to the 6,641 beds in 23 of the designated hospitals in the city. The 2 new hospitals will help alleviate this bed shortage, but it is still not nearly enough because, we're seeing an average of around 2,000 new infections a day from Hubei province in the past few days. And compounding that problem is also a severe shortage of diagnostic kits and medical supplies. So people who are infected don't necessarily get tested. We see reports of many of them queuing up for hours only to be turned away and asked to go home to self-quarantine. And these people may never get treated in hospital unless they get so critically ill. So there is reason to believe that the official count is actually far lower than the actual number of people who are infected. But as experts have said, 1,000 beds means 1,000 critically ill patients can be hospitalized, and that will at least reduce mortality rates and save more lives and relieve some of the pressures on the other hospitals. And the authorities have also ordered that hotels now be converted to treatment centers as well.
Now, Don, it seemed like an impossible task to build a functioning hospital in just days. How were they able to do it?
I want to say through sheer grit, it is a remarkable feat. And don't forget, there are 2 hospitals being built at the same time. So you can imagine that the amount of resources that's being poured into the city. More than 4,000 construction workers have toiled day and night to finish Shan in 10 days. And they started work on the night of January 23rd, and they finished just last night. And it is not just an empty shell, as you said, it's a fully functioning hospital with electricity, running water, sewage pipes, medical equipment, and their consultation rooms, there's ICU, the wards, and they're all constructed using prefabricated materials and containers. The construction area is about 33,900 square meters, which I think is just a little smaller than our Padang. But China is known, for its infrastructure building prowess. And during the SARS pandemic, it took just 6 days for them to complete a makeshift hospital in Beijing.
Of course, Dawn, the numbers are continuing to rise. It's still spreading. I have to ask, how is China galvanizing to combat this epidemic?
The central government has already launched a mass mobilization of resources from the entire country, and it has sent more than 7,000 medical workers to the epicenter, and it has backup teams as well that can be activated if necessary. It's also directed its state-owned companies to ramp up production of medical supplies, especially face masks and protective suits, which are in acute shortage. And in the meantime, it is importing millions of masks, and donations from around the world are also coming in. And then with the Chinese New Year break over now, factories are going back to work, and they're going back to 100% production, which means that China will be producing around 20 million masks a day compared to 8 million just last week. The state media have also been flooding various platforms with images and stories of bravery and sacrifice, and trying to galvanize people to come to
the number of cases.
And this nationwide effort to combat this outbreak has trickled down to every level, from the big cities to the small villages, and its ability to mobilize at such a scale to deal with the crisis is really quite remarkable, including locking down cities. And this is quite possibly hard for any country, especially liberal democracies, to do.
Well, thank you so much, Dawn, for the update. As always, do stay safe. Now, for those of you who are watching us, of course, you can get the latest updates on the coronavirus on straitstimes.com. On to our third segment, we will now have a live Q&A session where you can ask your questions to NUH Senior Consultant from the Infectious Diseases Division, Professor Paul Tambaya. Welcome, Prof.
Hi. Thanks for having me.
Yeah, now earlier we invited, Prof, our readers to ask their burning questions on Facebook. I think we can get things started with this. Now, first off, Prof, if you could tell us, how the virus spreads. Now, we have received many questions on this, and we have a question from a concerned reader, Thomas,
Thanks for having me.
who asked if an infected person coughs our readers to or sneeze onto a handrail or an item, we can get things how long would the virus survive on this surface?
Okay, we don't have the answer for this particular virus, but more than 30 years ago, there were studies done on the common cold coronavirus. And it's very interesting because the answer actually depends. And what does it depend on? It depends on the temperature and the humidity. At 6 degrees centigrade, the particles, the infectious virus particles, can stay on the surface for close to 100 hours.
How long would the virus survive on this surface?
Whereas at 30 degrees centigrade, they're gone within an hour or two. So it depends a lot on the temperature and humidity. At high temperature, high humidity, the virus is gone very quickly. At low temperatures, low humidity, the virus can stay for quite a while.
Wow. And okay, so Prof, we have a question from a live viewer right now, Iris Ng, who's asking how many days does it take to know if a person is infected, especially if it's asymptomatic, so there's no symptoms yet. And could you tell us how this virus can spread from one person to another?
Okay, there are 3 questions there. Right? So first question is if a person is asymptomatic. Now, I think it's important to clarify this. The asymptomatic people who have been documented to spread the virus, like the person in Germany, now they became symptomatic the next day. So they were asymptomatic for 1 day, and the next day they were symptomatic. So it's hard to control because you can't tell who's going to be sick the next day. You're not a fortune teller, right? But what it means is that when they are diagnosed, then you can do contact tracing. And that's how the Germans figured out, see who were the people who were infected, the people who were in the meeting with her. So asymptomatic person, you wait one day and you'll find out whether they're going to be symptomatic or not. So that was the first question about for an asymptomatic person. Now the second question was about how fast can you tell if you're positive. And in Singapore, we have this PCR test, which is actually based on the genetic material of the virus. And it gives us the answer within 5 to 6 hours. So they can run it 3 times a day. And I can tell you the lab people are working really hard. They're running this 3 times a day. So we get the results within 5 to 6 hours and we can act on it. We can start doing contact tracing.
Right.
What was the third question?
And the third question is, how does it spread from one person to another?
Okay, so the general belief is that it spreads by droplets. So what droplets means is that when we cough, when we talk, bits of saliva and bits of sputum, they leave our mouth. And if we sneeze, they leave our nose, and they travel about 3 feet. So in other words, you're just about in the safe place if I am infected.
Now, Prof, okay, on that note, right, because you mentioned with regard to droplets, there are questions that we've received as well, people asking, can I get infected through the eyes? And if so, what's the likelihood?
Okay, so most of these infections, again, we don't have solid data on this particular coronavirus, but we know from the common cold coronavirus, even from SARS, is that the transmission is primarily by droplet, but it's also by contact. And the reality is, without thinking about it, most of us rub our eyes about 1 or 2 times every hour. So if you pick up something, or if somebody sneezes onto your hand, and then you rub your eyes, that's how you're going to get infected.
Now, Prof, moving on, of course, to the second part of our discussion today on the mortality rate, China versus the rest of the world. We have readers like Gabriel and Chris who have asked, why is the mortality rate so high in Wuhan, China, now compared to the rest of the world? Could it be more than just the virus?
Well, the main reason why the mortality rate is so high in China is because the virus was in China long before it was anywhere else. In fact, from published reports in the medical literature, it was early in December when the first cases started showing up. And remember, what happens with this virus is you get infected, there's an incubation period, then you start getting symptoms, and usually the first few symptoms are relatively mild. You get a flu-like illness, and then somewhere on day 7, 8, 9, if you are unfortunate and you're in the 20% who's going to get into complications, that's when it starts going downhill. So we're talking here about 20, 30 days. So the rest of the world hasn't seen what China started seeing in December.
Right.
So I think there's this lag period that we're talking about over
Which
here,
is why it may
Which is probably why. And we've seen, once you start seeing cases in other countries, then you're going to start seeing deaths. We had that unfortunate case with the guy in the Philippines who died. So it's just a matter of time before we start seeing cases.
Right.
Second reason, I think, is that the hospitals in Wuhan are overwhelmed. Any major city would be overwhelmed with an epidemic of this nature and this magnitude. I mean, it led to the entire shutdown of the city. So obviously, when you've got this kind of situation, it's going to be tough for the doctors, nurses, and the resources available.
Now, Prof, also we have Sharon who asked, we're now focusing back here in Singapore on the 18 confirmed cases. Sharon is asking, why has no one been discharged yet?
Well, the simple reason, I think, again, I'm not directly involved in the care of any of these cases, but the simple reason is, as I mentioned to you, when people get sick, it's usually day 7, 8, 9. And the first case was only diagnosed on the 23rd of January. So we're barely at day 10 for the first case. So it's important to observe these cases because there's no specific approved antiviral treatment. And so the mainstay of treatment is recognizing complications, diagnosing them early, and treating them early. So I think the teams looking after them want to be careful, want to make sure that they're safe, that they pick up any complications ahead of time. And I think they also want to be sure that they're not shedding the virus. They have to have multiple tests to make sure that these people are not shedding the virus, so that if they're discharged, that it's safe for them to go back, to their homes, to their communities.
And Prof, just to understand better, have you met the 18 cases?
No, I haven't.
You haven't.
Although I'll tell you, we have infectious disease grand rounds, which are held every week. And very soon after the first case was admitted, the doctors from SGH and from the National Center of Infectious Diseases shared the clinical information about the cases so that we would know what to look out for. And that kind of collaboration between hospitals has been a feature of infectious disease work for many years in Singapore.
Now, Prof, we have a live viewer right now, Geoffrey Lim. Ming Hui. Now, he is asking right now on our Facebook, is there a chance that a person who has recovered can get a relapse of this virus?
Yeah, we don't know for sure, but intriguingly, people seem to think that if you have recovered, your blood may actually contain antibodies or parts of your immune system, which could potentially be used to treat other patients. You know, in the days before antibiotics and antivirals, what they used to do is they used to collect serum from patients who had recovered, and they used that for treatment. That's like a 100-year-old way of treating patients. And I can tell you, during SARS and during MERS, there were a lot of people who were talking about doing this. And what is really heartening is some of the SARS people who have recovered from SARS, actually some of the doctors, have come up to us and said, you know, I don't mind giving you some blood if you need it to treat somebody who is critically ill with this virus, because there's a chance that there may be cross-reaction and cross-protection.
Right. Prof, I just want to go back to earlier on when you mentioned with regard to that there have been reports that you received and you know the division received with regard to the condition of the patients, the updates, right? And you know, we know that in news reports, it's been said that patients are in stable condition. What does this exactly mean? You know, are they stable in a sense where they can eat, they're conscious, they're breathing through a ventilator? What does that mean?
Well, you know, again, there are different people who take different meanings, but the generally accepted medical condition is stable if somebody is in a regular ward. That means they're not in intensive care, they're not on a ventilator, they may be on some degree of supplemental oxygen, but that's about it.
Right, right. Prof, we have another one from our reader, Sivadas Krishnan. Now, Sivadas is asking, what sort of underlying illnesses would lessen the chances of recovery?
Yeah, so again, we have some information from China. There have been a couple of publications in major medical journals. And from what we can tell, the first patient who died was somebody who had liver disease. He had liver tumors. So liver disease, diabetes, these are some of the underlying conditions which have predisposed people to more severe disease.
Right. Prof, now moving on to our next topic that a lot of Singaporeans have chimed in on, which is on the use of the masks.
Right.
When to use the mask, right? One of the many, of course, who asked about the type of masks is Linda C. Now, she wants to know which mask is the best right now in this situation.
Right. So basically, I think what is important is that the masks need to be used by people who need to use them. So that's people in contact with confirmed cases. So healthcare workers in hospitals need to use the masks that are appropriate for them. And there's been quite a lot of research on this, comparing surgical masks with N95 masks. And the general consensus, which is what the World Health Organization has recommended, is that surgical masks are actually good enough, and the incremental gain from an N95 mask is not worth the effort. Because N95 masks are very uncomfortable. You know, you put them on, you end up rebreathing the air, your CO2 levels start to build up, and so there's a trade-off. Although they are higher efficacy in terms of filtration, but the downside is that you know, they're going to be very uncomfortable. And by and large, if an infection is spread by droplets, you know, there's the 3 feet thing, surgical mask is good enough. But the thing is, like, for example, influenza, which is spread by droplets, in certain times it can be aerosolized. So like, for example, if you're doing suctioning or if you're giving high flow oxygen or nebulizers, then at that point in time you might need an N95 mask.
And Prof, you know, when you know the news came out that that states healthy people, they do not necessarily need a mask, and of course a lot of netizens have chimed in and said that, oh no, you know, we need to put on masks as well. So we have a reader, Monsoon, who asked the questions which many are concerned about. Should we only wear a mask if we're sick? Now, wouldn't a mask help to protect a healthy person too?
Well, it does both. You see, the mask actually prevents or reduces the amount of virus you're going to shed. But ultimately, you shouldn't be walking around town with a mask if you're sick, because when the mask gets wet, it loses its efficacy. So ideally, you should put on a mask, go and see the doctor, and then get treated, get diagnosed and treated, so that if you indeed have a risk factor for the Wuhan coronavirus, then they can call the special ambulance, send you to the National Center for Infectious Disease. Now, the reason why people wear a mask is because they're not sure that people who are sick are going to be staying at home. And I think that is the message that needs to get across. You see, if you are sick, you shouldn't go to the office. You shouldn't take the MRT. You know, you should get yourself evaluated. You should put on a mask. Go and get yourself evaluated by your doctor. Ideally, you should call your doctor ahead of time, especially if you think you might have some risk factors. You know, if you just came back from China, maybe just over the 14-day period, and you're not too sure when your symptoms started. Call your doctor so that you don't sit in a crowded waiting room, and tell your doctor, okay, I'm going to come and see you. I'm going to put on a mask. Then your doctor maybe can clear the room. Or the doctor can say, hey, why don't you just go straight to NCID? So this is what I think people need to do. And if everybody does that, then there's no need to wear a mask, right? Because then everybody walking in the streets is going to be healthy. And then you don't need to worry about the guy coughing in your face and infecting you. But right now, you see, too many people are worried that there are people who are sick walking around, see, and that, I think, needs to be addressed. So
at the end of the day, it's really about being a responsible person. If you're sick, if you're unwell, then best is that you wear the mask, right?
But it's actually not just the individual. The whole system has to be structured so that, you know, you don't get stigmatized. And this is coming out a lot in many countries. You know, it's not just people who are sick, but even certain ethnic groups like mainland Chinese are getting stigmatized in certain countries. And you know, once you stigmatize people, they're not going to come forward. And that's bad public health. Because if they don't come forward, they're going to infect even more people. See, or they're going to try and, you know, hide their illness. But if you make it such that people find, if you come forward, you get treated, you get better, you're not coughing away, you're not, you know, having a terrible pneumonia at home and infecting people on the way, then, you know, it's kind of counterproductive. So the ideal is that if you're sick, you get yourself treated, you take yourself out of the crowded situation, then people out there don't need to wear a mask.
Now, Prof, let's just go back to the part where, you know, earlier on you mentioned about cases of SARS as well. And a lot of our viewers are also asking on the show right now, you know, this new coronavirus has been compared to the SARS virus. How different or even similar are these two viruses?
Yeah, the viruses are actually very similar. In fact, if you plot their genome or their genetic structure, the SARS virus is one of the closest viruses to this particular virus. In fact, it is the closest human virus to this virus. But having said that, there are certain other viruses which are close to the SARS virus which behave differently. But right now, what we have found out is that there are many characteristics of this virus which are similar to the SARS virus. The way that it causes a kind of atypical pneumonia, the fact that it can spread in hospitals, that's from people who are not properly isolated right at the beginning. So there are similarities, but I think it's still a bit too early to identify how the virus is going to turn out.
We have a question here, Prof. Our live viewers, Imam and Doreen. Now they're asking, in your experience, how long will this sort of epidemic last? 1 month? 2 months?
Well, you know, I've gone on record saying that I'm pretty sure that once the hot weather comes in, this epidemic will die. And you know what happened with SARS? The numbers were increasing and increasing, and then when the hot weather came to Beijing, all of a sudden the numbers just plummeted. And this happens with a number of respiratory viral infections too. In temperate countries, the flu is a winter disease. Once the hot weather comes in, the flu kind of disappears. So I'm pretty confident we'll have a quiet June.
Now, Prof, you know, just to end off our segment today, Prof, anything else, you know, you would like to highlight to kind of sort of give a closing to our segment here?
Well, you know, the way that this virus is going to be controlled is the way SARS was controlled. That means you find every case, you isolate the case, you quarantine the contacts, and you make sure that there's no chains of transmission within the community. And I think that's the key, and that's what the Ministry of Health is doing. They're trying to find every case of the viral infection. It's very challenging, especially if you're infectious the day before the onset of symptoms. But hopefully we'll be able to do it.
Well, thank you so much, Prof, for coming onto the show to share your valuable insights with regard to the coronavirus right here. And certainly we have lots that we have learned from you today. Again, for those of you who are watching us as well, thank you so much for your questions. Now, for more on the coronavirus, head on to Straits Times website. There we have it, our top stories for today. For more news and videos, do log on to straitstimes.com. Once again, I'm Haryanto. See you tomorrow for more stories on The Big Story.